Hi there, my name is Goda and I will present you with some tips on how to develop a physically active lifestyle for a patient with diabetes. First of all, the importance of physical activity for healthy individuals and those with diabetes is proven. It reduces blood glucose levels, improves insulin action, improves insulin absorption from the injection site, improves glucose consumption in cells without increasing the need for insulin, improves blood circulation, protects against atherosclerosis, helps regulate blood pressure, reduces the risk of developing ischemic heart disease and stroke, helps prevent obesity, slows down the progression of osteoporosis, strengthens muscles, and regulates digestion. So here is a bunch of tips and recommendations how you can help develop a physically active lifestyle for a patient with diabetes. First of all, plan physical activity in advance. It's advisable to exercise after 1 to 2 hours after insulin injection and a meal. Also, choose the right physical activity. Start with 10 to 15 minutes a day and gradually increase the load. Also, it is very important to learn to regulate physical activity according to the heart rate. If the patient does not have coronary heart disease, after starting to exercise, he should try to reach a pulse rate equal to 50% during each session of his maximum heart rate. After a few months, it is recommended to increase the pulse rate to 75% of the maximum. The maximum pulse rate can be calculated approximately according to the formula. For men, from 220 minus the years of the patient's age. For women, from 210 minus the years of the patient's age. It is necessary to check the level of glucose in the blood before, during, and after physical exertion. It's appropriate to measure glycemia in the evening after exercise. Adjust the insulin dose. Since the risk of hypoglycemia remains up to 36 hours after physical activity, the next dose of insulin should be reduced. It's recommended to reduce the insulin dose by 20 to 50% if the physical activity is planned to last 1 hour, and even more if the physical activity will be more intense than usual. Do not administer insulin to those areas that are close to the muscles that are stressed during sports, because the absorption of insulin will be accelerated. For example, when playing basketball, do not inject into the arms. When running cross-country, do not inject into the thighs. Adjust the diet. Carbohydrate intake depends on glycemia before exercise. Choose the right footwear and socks. If the patient is taking medication, sugar, glucose tablets, or juice should be available to correct hypoglycemia during exercise. Drink plenty of water before, during, and after heavy physical activity to rehydrate. We hope these tips are helpful, and physical activity practiced by patients will make them feel better and live a full life.